will be a little bit different, as today is a viewer request special. I was asked by one of the listeners in this channel to take a look at this particular article from Scientific American. What went wrong with a highly publicized COVID mask analysis? So that is going to be the video for today. Is going to be a little bit of a review of what's going on in this particular article. Let's get into it. So I do want to say up front, when I read this piece, it immediately smacked of being an opinion piece, which I do think it is, based upon that. But it does make some good points, which you might be surprised to hear me say that, because I have had some pretty harsh critiques, among others, for pieces written in Scientific American by a number of different authors. So I did want to say that up front, that there are some good points made. I also think that there's a particular problem with it. And it's kind of emblematic in the second line here, after the title, which is the Cochrane Library, a trusted source of health information, misled the public by prioritizing rigor over reality. I will say here, I do think this is very much an opinion piece in here, but there are some good points made. I also have a link to the original thing in here, because they did do a good job of linking to the original piece that is being critiqued. Now, this is the opinions of the author, specifically Naomi Oreskes. The COVID-19 pandemic is ongoing, but in May, officials ended its designation as a public health emergency. So it's now fair to ask if all our efforts to slow the spread of the disease, from masking to hand washing to working from home, were worth it. One group of scientists has seriously muddied the waters with a report that gave the false impression that masking didn't help. Now, here's the thing with that. I always think it's fair to ask in the process whether or not something will work. It is entirely fair to ask before you get into doing something whether or not it will work, whether or not it's appropriate. You can base that on prior literature. You can base that on reason and rational discussion and debate. So the suggestion here that it's fair to ask now if efforts to slow the spread were worth it. That's not to say. I will say I don't think the author is saying that you couldn't ask and have those debates beforehand, but the phrasing, I think, can come off that way as an interpretation that someone might get from it. So I just want to caution the reader there to not necessarily take that interpretation of the author's words. Let's see. The group's report was published by Cochrane, an organization that collects databases and periodically issues systematic reviews of scientific evidence related to healthcare. This year, it published a paper addressing the efficacy of physical interventions to slow the spread of respiratory illness such as COVID. The authors determined that wearing surgical masks, quote, probably makes little or no difference, and that the value of N95 masks is very uncertain. Now, you can kind of see it with the next paragraph. There is, and I got into this with Kieran in a side chat Saturday, Kieran White, the founder of Wokescreen, which, by the way, promo code ScioSophia, you can get 10% off your membership in Wokescreen. Don't forget. Here, in fact, let me put that one up before I totally forget myself. Don't forget that you can use my promo code at wokescreen.com when you sign up for a membership. You get 10% off. Anyway, that there is a distinct difference. Most of you will not see studies, the raw studies. You will never be going to look for them. Most of the time, you will get them through the news media, filtered through the media in various ways and forms. And it's important to recognize that, because a lot of times, as Kieran pointed out himself, the journalists who are pushing such things are not experts in the science themselves, but they're just looking for something quick to write up, and they can engage in journalism, which is basically just taking the press release and putting it out there. Those kinds of different things, as well as, let's face it, journalists do have some of their own biases involved here and will and will, particularly if you're talking about something like MSNBC or the other end of the spectrum, put their own kind of spin on things, which is inappropriate and not necessarily helpful to the readers. So it's important to understand that there's a difference between the scientific study and what that says, and oftentimes what you may get and hear from news media. And so that's one of the reasons I tend to go straight to reading scientific studies myself rather than relying necessarily on news media coverage, because sometimes you will find that that this is the case, that what gets filtered into the media, which most people read, most people don't read the studies themselves, can be, shall we say, somewhat different from what's actually said in the study. And while I have disagreed with the Scientific American on a lot of things, that is actually made very well in this article in the next couple of paragraphs. The other problem is, of course, when scientists themselves, or scientists who engage in activism, or shall we say, better said, activists masquerading as scientists, misuse their work. Hi, darling. I have a cat rubbing my leg. Misstate their own work and mischaracterize it to make a particular point in line with what they would ideologically like to see. So you can have that also. There's another point that I want to make because it comes up, and all three of these are kind of woven into this article. There is a question here. Again, we go back to the role of science. And this is where I come back to critiques of Science, Scientific American, and Nature. Have all done this, where they've basically gone on and ranted and screamed. And this has come up particularly in the context of Supreme Court decisions in the last couple of years, where they rant about the court being anti-science. Well, hold on a second. What is the purpose of science versus the purpose of the Supreme Court? There's a difference between that we have to be cognizant of. And let me give you an example. Just because a study may say, or a bunch of studies may say, or community of scientific experts in public health or something like that may say, doing X thing will help prevent the spread of a virus, or will keep people healthy, or will do this, will do that. The next question that comes after that is the legal kinds of questions, and in the case of the United States in particular, the constitutional law kinds of questions on whether or not the government has the authority to do that. Does it infringe upon the rights and liberties of individuals to do such a thing? Now, there were many who argued, for example, that no, you cannot force people to stay in their homes, even with a pandemic, because of, well, you're infringing on their freedom of movement. You're infringing on their ability to interact and associate and protest if they want to protest. All of those kinds of rights and liberties, which you're not allowed to do. Same kind of thing with a mask mandate. Do you really have a right to force people to wear a mask? Even if the study or studies or anything like that says that not a mask mandate, but wearing a mask helps reduce the spread of a disease. Even if that, one does not necessarily follow from the other. A scientific study can tell you a lot about, do these kinds of interventions potentially work? But the authority of a scientific study, public health study, stops when it comes to the public study, the public implications and the constitutional law implications and what have you. And that goes for any kind of scientific study. There's a point to be made in that to remember that there is a distinct and very good break between what you get from scientific studies and then how do you deal with that in practical implementation and application, which is interesting because Naomi actually did get into this herself in the writing of this article. So let me continue with all of that context in mind, because you see those kinds of three themes get wrapped up in here. And that's the point I want to make. So we were here. The conclusion of this particular study, N95 masks, is very uncertain. The media reduced these statements to the claim that masks did not work. Under a headline proclaiming the mask mandates did nothing, New York Times columnist Bret Stephens wrote that, quote, the mainstream experts and pundits were wrong and demanded that they apologize for the unnecessary bother they had caused. Other headlines and comments declared that masks still don't work and that the evidence for masks was approximately zero, that face masks made little or no difference, and even that 12 research studies proves masks didn't work. Carla Soares-Weiser, the Cochrane Library's editor-in-chief, objected to such characterizations of the review. The report had not concluded that masks don't work, she insisted. Rather, the review of the studies of masking concluded that the results were inconclusive. Now, I actually do think this is a very good distinction that Scientific American is making. Everybody does this right and left, where they'll say something, where they'll see studies put out, okay, we looked at this thing, but the results were really inconclusive, so we can't really make a call one way or another. And then they'll jump to, oh, it doesn't work. There's two different things there. You can look and have a study that shows that something didn't work, and that would be valid. But being inconclusive doesn't mean that it doesn't work, or it doesn't mean that it does work either. Being inconclusive about something is pretty much like flat in the middle here with this. And you really can't jump to say either way that, yeah, no, it doesn't work or it does work. You really can't say that. This is actually a very good point in the article. People don't often make this distinction, but a lot of scientists do when they're doing their studies. And so the Cochrane Library making this was just like, well, sorry, a lot of these randomized controlled trials, when we take them all together, the results are so mixed, we can't really make a conclusion. That was actually what the report said. And actually, you can look at that more in here with a lot of these things. This is the actual report. And I will say, as a note to the Scientific American kind of authors, when they have the link in their article, you can see what it says here. This is not the most recent version. That's actually the version that's linked in the Scientific American article. It's not the correct version. This is the one that is. It's updated as of earlier this year, as you can tell, and it includes now the studies related to COVID-19. So just a point on that. In fairness to the Cochrane Library, the report did make clear that its conclusions were about the quality and capaciousness of available evidence, which the authors felt were insufficient to prove that masking was effective. So this is, again, a note on statistical things about proving and what have you. If it's insufficient to prove that it was effective, that doesn't mean it's sufficient to say that it was ineffective. Getting into that thinking of just saying it's insufficient to say it was effective, well, therefore it means it's sufficient to prove that it was ineffective, that's a false dichotomy. You can't do that. It means you just don't have evidence to either way, really. They weren't, so you can't do that. It was, quote, uncertain whether wearing surgical masks or N95 P2 respirators helps to slow the spread of respiratory viruses. Still, the authors were also uncertain about the uncertainty, stating that their confidence in their conclusion was low to moderate. You can see why the average person would be confused. Yes, and this is, again, goes back to the point of filtration. A lot of folks who don't understand necessarily the uncertainty kind of questions and all those kinds of things in there, it is a problem in here when you're talking about communications. And again, the filter of the media, and also the added thing of the disbursement on social media, which can run in all sorts of kinds of different directions. So I'm trying to be fair with this, and I will point that out here also, in that you do have a lot of these kinds of things. We included 12. This is from the actual article and the actual report in question. Medical surgical masks compared to no masks. We included 12 trials comparing medical surgical masks versus no masks to prevent the spread of viral respiratory illness. Wearing masks in the community probably makes little or no difference to the outcome of influenza-like illness compared to not wearing masks. Wearing masks, okay. Yeah, and they're saying right here, like, moderate certainty, all those kinds of things. Wearing masks in the community probably makes little or no difference to the outcome of laboratory-confirmed influenza SARS-CoV-2, which is COVID-19, compared to not wearing masks. Harms were rarely measured and poorly reported. So this is the kind of thing, though. But they are very clear in here that a bunch of this is that, you know, we're not 100% sure in all of this. N95P2. We pooled trials comparing N95P2 respirators with medical surgical masks, 4 in healthcare and 1 in a household setting. We are very uncertain on the effects of, this is the language that Naomi was talking about. We are very uncertain on the effects of N95P2 respirators compared with medical or surgical masks on the outcome of clinical respiratory illness. N95P2 respirators compared with medical or surgical masks may be effective for influenza-like illnesses, as I believe what that means. Yeah, influenza-like illnesses, which includes COVID. Evidence is limited by imprecision and heterogeneity for these specific outcomes. The use of N95P2 respirators compared to medical or surgical masks probably makes little or no difference for the objective and more precise outcome of laboratory-confirmed influenza infection. Restricting pooling to healthcare workers made no difference to the overall findings. Harms were poorly measured or reported, but discomfort wearing medical or surgical masks or N95P2 respirators was mentioned in several studies, very low certainty evidence. One previously reported ongoing randomized controlled trial is what that stands for, has now been published and observed that medical and surgical masks were non-inferior to N95 respirators in a large study of 1,009 healthcare workers in 4 countries providing direct care to COVID-19 patients. So, let's see. There's a high... Okay, this is the author's conclusions themselves. The high risk of bias in the trials, variation in outcome measurement, and the relatively low adherence with the interventions during the study hampers drawing firm conclusions. So they're not making a firm conclusion either way. They actually do very much say this in this particular study. There were additional RCTs during the pandemic related to physical interventions, but a relative paucity given the importance of the question of masking and its relative effectiveness and the concomitant measures of mask adherence, which would be highly relevant to the measurement of effectiveness, especially in the elderly and young children, which is just to say certain problems with dealing with things in the real world. We'll get back to that in a minute. There is uncertainty about the effects of face masks. The low to moderate certainty of evidence means our confidence in the effect estimate is limited and that the true effect may be different from the observed estimate of the effect. The pooled results of randomized controlled trials did not show a clear reduction in respiratory viral infection and the use of medical surgical masks. There were no clear differences between the use of medical surgical masks compared with N95P2 respirators in healthcare workers when used in routine care to reduce respiratory viral infection. Hand hygiene is likely to moderately reduce the burden of respiratory illness, although this effect was also present when influenza-like illness and laboratory-confirmed influenza were analyzed separately. It was not found to be significant difference for the latter two outcomes. Harms associated with the physical interventions were under-investigated, which is to say, what was the bad things that didn't get investigated, essentially. There is a need for a large, well-designed RTCs addressing the effectiveness of many of these interventions in multiple settings and populations, as well as the impact of adherence on effectiveness, especially in those most at risk of respiratory illnesses. So that's the conclusions of that report that Naomi is criticizing. What is going on here? But you can see what the point is. The authors basically said, evidence is kind of really sketchy. We can't really say either way, but the media did go off in a direction to say, oh, look, it's not effective. And then there were other media that said, oh, yes, it is effective. Let's go. This was not just a failure to communicate. Problems with Cochrane's approach to these reviews run much deeper. A closer look at how the mask report confused matters is revealing. The study's lead author, Tom Jefferson of the University of Oxford, promoted the misleading interpretation. When asked about the different kinds of masks, including N95, he declared, makes no difference, none of it. In another interview, he called mask mandates scientifically basis. Now, I will point out that they do conclude that it likely makes very little difference. That conclusion is in there, but it's not a very high certainty of it. They don't have a whole lot of confidence in it. So there is a certain degree of question of how much Jefferson, the author, is perhaps pushing something a little bit too much where he shouldn't, where he knows that conclusion is there. And that's Naomi's point with this a little bit, which I can understand. Actually, one as a scientist, should be cognizant of the uncertainty around your own conclusions before you go and push things. Recently, Jefferson has claimed that COVID policies were evidence-free, which highlights a second problem: the classic error of conflating absence of evidence with evidence of absence. Now, this is a point that I want to get back to. They're not proving that the masking doesn't work. But what they did find is that the masking probably didn't help either, necessarily. But they don't have a very firm conclusion. Again, I just read it from the article itself. That would be the assumption I would make also. They think this, but the evidence is kind of so they're not sure about the conclusion. So, and that's the point here. Though they did actually make the statement, and I think Naomi is wrong about this, they did make the statement that they think it doesn't work very well to do the masking. They make that statement, but they also do add to the conclusions that they don't think they have a whole lot of evidence to make that very firmly. And that's a fair statement to point out that. But yeah, that happens a lot. Absence of evidence with evidence of absence. Don't conflate the two. That is actually a very good point. And again, this is probably going to sound weird for most of the folks who are listening to this, because I'm usually very critical of Scientific American, but this is actually a very good point. Evidence of absence and absence of evidence are not the same thing. Just because you don't necessarily have evidence of something doesn't mean the effect isn't there. Lee Gissom got into this when I was on with him in Side Chat Saturday, also, in that you can have many studies where maybe it doesn't even show in the study because the effect is so small. Absence of evidence does not equal evidence of absence. Just remember that one on that point. The Cochrane finding was not that masking didn't work, but that scientists lacked sufficient evidence of sufficient quality to conclude that they worked. That's the question they were setting out to answer, was, is masking effective? They weren't setting out to answer the question of whether masking is ineffective. You can have it be somewhat both ways here. Jefferson erased that distinction, in effect arguing that because the authors couldn't prove that masks work, one could say that they did work. That's just wrong. So, now I will make a point here, is that this is one author's interpretation. Naomi herself did say earlier, no, I don't agree with that distinction either. I don't agree with that conclusion either. And this is where reasonable people may disagree. Though I do think it is a good thing to point out that I do think Jefferson did go for a false dichotomy with this. I do think that's actually entirely appropriate. But what I very much disagree with here is where Naomi goes next, is conflating this author's interpretation of their work with, perhaps incorrect interpretation of their own work, with Cochrane as a whole, which I very much disagree with. That I think was inappropriate and somewhat of I don't think it was quite a non sequitur, but not necessarily appropriate to smear a whole group when this particular issue is the interpretation of a single author. Cochrane has made this mistake before. In 2016, a flurry of media reports declared that flossing your teeth was a waste of time. Feeling guilty about not flossing, the New York Times asked, "No need to worry," Newsweek reassured us, because the flossing myth has been shattered. But the American Academy of Periodontology, a dental professors, dean of dental schools, and clinical dentists, including mine, all affirmed that clinical practice reveals clear differences in tooth and gum health between those who floss and those who didn't. What was going on? So, you notice something. I kind of doubt that, to be honest. Because on the one hand, you're saying, oh, there's inconclusive, but then you have this coming up. I think there's a conflation there, again, between what that author did in interpretation of their own work versus what's going on with this. So I don't think that's necessarily appropriate on the part of this author in Scientific American. But anyway, the answer demonstrates a third issue with the Cochrane approach: how it defines evidence. The organization states that it reviews, quote, identify, appraise, and synthesize all the empirical evidence that meets pre-specified eligibility criteria. The problem is what those eligibility criteria are. Cochrane reviews base their findings on randomized controlled trials, often called the gold standard of scientific evidence, in medicine specifically. But many questions can't be answered well with RCTs, and some can't be answered at all. Nutrition is a case in point. It's impossible to study nutrition with RCTs because you can't control what people eat. And when you ask them what they have eaten, many people lie. Flossing is similar. One survey concluded that 1 in 4 Americans who claimed to floss regularly was fibbing. So, in fact, there is strong evidence that masks do work to prevent the spread of respiratory illness. It just doesn't come from RCTs. It comes from Kansas. In July of 2020, the governor of Kansas issued an executive order requiring masks in public places. Just a few weeks earlier, however, the legislature had passed a bill authorizing counties to opt out of any statewide provision. In the months that followed, COVID rates decreased in all 24 counties with mask mandates and continued to increase in 81 counties that opted out of them. Now, this is where I want to get into an important distinction. Naomi's contention here is that there's too much focus on randomized controlled trials. Okay. This is, I think there's a point here to be made. If you're interested in looking at if a specific thing is effective, or a specific thing has a very good impact, what you would generally try to construct is an experiment where you are controlling for everything else and just letting that one thing vary and see what happens. This is very easy to do in a numerical modeling situation. It is much harder to do when you're dealing with people. That's why I think Cochrane tends to focus on randomized controlled trials, is because that's the closest thing you can possibly get, perhaps, to controlling for all of those other kinds of factors. Is it perfect? Absolutely not. And you certainly, Naomi is correct that you can't do that with nutrition. People would lie, unless you're going to do some kind of big study where you're paying people to, be in the same place and eat the same things for months on end, where you can watch people like that and have people submit to that, which would probably violate all sorts of IRB rules. That's not going to work. So there is something to be said for the fact that randomized controlled trials cannot answer everything. But that does not mean they're invalid in any way, shape, or form in here. And what I have an issue with this thing in Kansas is, well, okay, what else was going on? Were people more out and about in areas without the mask mandate than they were with the mask mandate? And so they were interacting with more people, and so they were getting into more situations where they could contract the virus. That could happen with or without the mask. So in that real world situation, it is very real world. But the question I have is how many of them also were having requirements to stay home, essentially, or lockdowns. That is where you find confounders in these kinds of things, and you have to legitimately ask those questions. So that is just the question I would ask. Again, same kind of thing with this study with the mask mandates. She gets into the next thing here. How much of that was the mask mandate and how much of that was people just staying home? You can't get at that, something like that, without a randomized controlled trial. Let's see. Cochrane ignored this epidemiological evidence because it didn't meet its rigid standard. I have called this approach methodological fetishism, when scientists fixate on a preferred methodology and dismiss studies that don't follow it. Sadly, it's not unique to Cochrane. By dogmatically insisting on a particular definition of rigor, scientists in the past have landed on wrong answers more than once. I disagree with the sentiment here, because how the heck are you going to isolate what the effect is from a particular intervention in this case? Like I said, it's easier to do with numerical models of the physical environment. Like you could do this with a climate model effectively. You could hold a whole bunch of things fixed and then vary the last thing and, oh, okay, we think it might work this way and all this other kind of stuff. You can do that in a chemistry lab actually quite easily, where you have, say, you've got 3 different beakers set up and you're putting different quantities of this chemical reagent you want to test into this beaker, this beaker, and this beaker, and seeing how strong the reaction is, because maybe you want to know how sensitive this other chemical is to that particular reagent. Does it blow up if you put a lot in it, or does it not react at all if you put a teeny tiny bit in it? What's the kind of magic number in the middle? That's a controlled experiment where you can actually figure out the relationship of that reagent to the to the particular thing of interest. So, no, it's not necessarily rigor as much as trying to isolate the intervention of interest. I think she is wrong on that. But it's a really interesting take, and I don't necessarily disagree with her concern about fixating on a particular methodology. But it is a question of whether or not the methodology in question gets at the particular question of interest, which the question of interest was whether or not masking works. And in some of the studies that are sort of more real world studies, yeah, I can understand that, but we also have to note all the confounding factors that make those conclusions much less certain, which is not what's being talked about here with Naomi's discussion. We think of proof as a yes or no proposition, but proof is a matter of discernment. Many studies are not as rigorous as we'd like because the messiness of the real world prevents it. She's not wrong about that. But that does not mean they tell us nothing. It does not mean, as Jefferson insisted, that masks make no difference. The mask report, like the dental floss before it, used standard Cochrane methodological procedures. It's time those standard procedures were changed. I kind of disagree with that because at least you can look at some of the randomized controlled trials, but I think, in a sense, maybe add a group that looks at the more real world studies. Why not? Do the cross comparison. This kind of study says this kind of study says that. Okay, how do we bridge the gap? That would actually be a really meaningful contribution to the scientific analysis that's there. But I digress. Overall, with this piece of Scientific American, actually, it does make some very good points. But I do think rigor is actually really, really important. In also sort of recognizing the caveats to sort of the real world studies where you can't control everything. You actually have to account for those particular confounders, and I think that got ignored by the author of this piece in Scientific American, though I can certainly understand the issue with that. So, again, though, the masking study that they're highlighting here, she is right to point out that while they said, they think that masking is fairly ineffective, they also point out themselves in that piece, and Naomi points out here, that the uncertainty was high, shall we put it that way. So it's not necessarily a conclusion that you should jump from the rooftops and say, don't jump from the rooftops, first up, that you should jump up and down and say, this is, we shouldn't be doing the masking. And the final thing I want to say is, again, where science stops and then legal, constitutional law, and all those kinds of policy-related things start, science can give us a sense of whether or not something might work, whether or not something would reduce the spread of a disease, whether or not something would be effective in management, whether or not, what this physical thing going on here is. That's where its authority stops in all of this. After that, where it becomes really somewhat important to understand the distinction, is the question of the legal. The constitutional law. Yes, scientific studies and what have you suggest this intervention would be effective. Do we have the right, the authority to do that? What other things does it do to the economy, to education, what have you? There's been a number of things that have come out since, in the last couple of years in particular, talking about how bad the lockdowns were for education of the kids. So those kinds of things must be tussled with. And if you're talking about policymaking, there's more than one issue to deal with than what the science says. And scientists themselves have to be very mindful of that they're not the only ones providing guidance and information to a stakeholder, to any decision maker. And the reason I mention that is, that's going to mean decision maker will make a decision probably that you don't like because they're balancing competing interests and also wanting to make sure that folks are well, not just in terms of respiratory illness, but also in terms of amount of depressive related things that can happen in other ways, and economic related things, making sure folks can still have jobs and what have you. Those kinds of things play a role too. So let me know what you think. Hit the like button on the way out the door, comment on the video, share the video, subscribe to the channel, all that lovely good jazz. Until next time, I'm Adrian. May you stay curious, everybody.